A disastrous rollout of the federal government's health insurance exchange has been quantified. Fewer than 50,000 people have used it to successfully obtain new insurance. Good morning and welcome to the News Hub. I'm Michael Casey. We're joined now by Louise Rednowski for exclusive details on the continuing troubles of HEALTHCARE.GOV. Good morning, Louise.
Good morning.
Well, the Obama administration was aiming for 500,000 enrollees in the first month of this program, Louise. 50,000 is a pretty poor hit ratio. Can this thing be fixed?
The administration is confident that it can be fixed and that they will be able to see enrollment tick up over future months. They'd always been expecting for enrollment to tick up over future months. That said, they were confident that they were going to be able to get in 500,000 in the first month because, of course, they didn't anticipate that the website was going to have the problems that it did. Some of the folks we've spoken to said 50,000. That's actually pretty high under the circumstances.
Okay, fair enough. But I mean, there has been very bad PR surrounding this. And is there any concern that that will undermine what would have otherwise been this natural pickup over time that you're referring to? I mean, discouraged participants, for example.
The bad PR matters for three real reasons. One is that it's certainly unnerving Democrats on the Hill. They have to be persuaded to hold the line for a few more weeks and not jump onto legislation that might undermine the law as far as Democrats are concerned. The other part is the insurers. They're really worried about the risk pool that's coming in. They're convinced that the only people who will battle through the system as it's currently set up are sick people, and they want young, healthy people to balance out that risk. And of course, the third group are people who need to be persuaded to enroll in order for this thing to work, probably around the holidays. They've heard bad things about the website. They've now heard about it, which is one thing, but they really need to be persuaded to overcome those perceptions. It's a real challenge.
Where do things stand in terms of the personal mandate, that requirement that people at a certain date, I think it was supposed to be in the beginning of next year, if they didn't have it, were compelled to actually buy insurance? If they can't do so, is that deadline going to be extended?
Well, right now it's still in force. You have to have coverage starting January 1st or face a penalty. That said, the penalty will not be applied. There's an exemption for people who have coverage any time after what's March 31st now. There's a 3-month grace period, essentially, as long as they maintain it for the rest of the year. The administration has already extended that by 6 weeks. It was previously around mid-February, likely in recognition of some of what's going on here.
And they're now saying they do expect to have the problems on the website fixed, I believe, by the end of this month. Is that a likely, can they meet that timetable?
Right now, they're saying that they are finding new problems every day. They're solving old problems, but in more glitches the further people progress into the site. And so that's a real concern. And certainly there's a lot of people speculating that November 30th is not a realistic option.
I mean, lots of good reporting to come, I imagine, on exactly what did go wrong. But for now, you know, what sort of things can we say are at the heart of this problem?
At the heart of the problem with the website, there's a front-end problem. People couldn't create accounts. That's largely been resolved. There's still an identity verification problem. People can't get the system to believe they are who they say they are and determine their eligibility to buy coverage or to get tax credits. And then the enrollment data right at the very end of the system was going incorrectly to the insurers. It was incomplete or there were duplicates. There were incomplete and duplicate submissions in the kind of data that we reported on. But the people who are familiar with that data say those largely been resolved, so there aren't duplicates in the 40 to 50,000 number.
We'll see if they can get this thing done in time. Thank you very much, Louise.
Thank you.